Hey everybody, Dr. Mark here. Thank you for joining. I am super excited today. We're having a discussion, interview, perhaps even a debate with Dr. Eddie Weller. So thank you so much for joining us today. And we're going to get right into it, Eddie. Always excited to talk to you. Question right out of the gate. How do you define chiropractic in your office? And I know you mentioned you wanted to talk about analysis too. So let's start with the big picture. How do you define chiropractic in your office?
I need to clarify that a little bit. Am I defining it with my intention, me as a chiropractor, or am I defining it to a quote said patient or client?
Well, obviously, it's going to go into our practice membership. So let's talk as a chiropractor to a chiropractor that how you define chiropractic in your office, ultimately setting your scope of practice.
Last night I was at dinner and sitting at a sports bar, and we're sitting here, and this woman says, to her friend, "Man, I thought my head was gonna pop off." And I'm like, "Whoa, okay." And so of course I lean on over and I'm listening, and so they're chit-chatting, and sure enough, the person 2 seats next to me, the guy's like, "I go once a week to get cracked." I'm like, these two people don't know each other and they're talking about visiting their chiropractor. And so I said, "Excuse me." And they said, "Yeah." And I go, "Excuse me." And he said, "Yeah." I says, "Could we meet each other right now?" And they said, "Okay." This happened last night. So could we meet each other? And so I heard pop and crack, and I thought my head was going to fall off. And I heard once a week. I said, "So you have to understand what a chiropractor does is they should analyze the spine, identify any neurologic compromise or structural compromise within that spine, make a very precise, specific adjustment to that spine, and then check that spine, making sure that it's neurologically sound. How they adjust is one thing, but when you say you're going once a week, that would be a problem because are you getting adjusted every visit?" And he said, "Well, yeah. Isn't that normal?" "No." And I said, "You felt like your head got twisted off. By the way, that's not normal." And so to understand chiropractic, if there's a nervous system within the spine, me, believe it or not, guys, I'm a chiropractor if you can't tell. I said, my goal is to analyze the spine structurally and neurologically. And then from there is a wisdom, an intelligence, if you will. They call it the neurologic system. There's an intelligence in that nerve, and it knows more than we do. So I respect it. I not only respect it, but I watch this spine and I monitor the spine with a gauge. Believe it or not, chiropractors have their own tools. They're like, "What?" Yes. So there's a gauging system that chiropractors have. We take pictures, imaging of the spine, so we know structurally and neurologically what's going on. So the chiropractor's goal, if you guys go to your chiropractor, you should ask them, "Hey, are you analyzing the spine before and after the adjustment so the intelligence, wisdom in the nervous system is doing the best it can with what it has to work with?" That's chiropractic.
Okay, so define it. Give me the definition.
Hmm. Gosh, in a nutshell, Cliff Notes, you want that definition of that.
No, I
I
want
think
your
I think
definition.
chiropractic, I
I,
think
I,
chiropractic
now
outside
I
of
find it interesting that when I do ask this question to chiropractors, the vast majority struggle with this answer.
well, it's the struggling is the simplicity of is chiropractic. Am I going back to the adjustment done by hand? Well, that's not chiropractic any longer because there's instruments that adjust. So I think chiropractic is the analysis of the spine. I'm a spine guy. My definition, right? Um, is the analysis of the spine to identify something called a vertebral subluxation and understanding that that subluxation can compromise normal neurologic function. And by restoring that, you have the body go from an abnormal functioning state to a normal functioning state. So the premise and the understanding of chiropractic is analyzing the spine, adjust the spine when needed to allow the body to adapt to life's crazy stressors.
Okay, and will the body always be normal after that?
No, because of the matter
Okay.
that its limitations. I model it after I'm a mechanic, and you're bringing me a brand new Ferrari, or you're going to bring me a Model T Ford. Regardless of the age of the car and what's going on with the car, every car works better tuned up. And if it works better tuned up, how do you know it's tuned up? Well, mechanics have gauging systems to know they made a difference. Chiropractors do as well. And so again, this is I think the argument that most chiropractors have is they believe a cavitation is an adjustment. And I
Okay,
don't.
but now let's stick to the question.
Yeah.
Um, so if I could give you my definition now, since
Yeah.
you gave yours, And I think this is vital to not only every chiropractic office, but ultimately to the success of the profession. That if we say chiropractic is the analysis and the adjustment of vertebral subluxations because they, in and of themselves, are detrimental to the expression of innate impulses and trophic impulses. Chiropractic is all education toward this objective, and chiropractic is nothing else.
I'm just trying to remember the last part of the sentence. All education as far as this objective.
Toward this objective of the adjustment of vertebral subluxations,
Oh, it is.
and chiropractic is nothing else.
And if
So
we had
it's
to dumb it down even further than that, it's the analysis of the spine to identify if the spine is
okay.
subluxated.
Hold up. Let me repeat it for you. Chiropractic is the analysis
Hmm.
and the adjustment of vertebral subluxations
Hmm.
because they, in and of themselves, are detrimental to the expression of innate impulses and trophic impulses. Chiropractic is all education toward this objective. Chiropractic is nothing else.
Define trophic for me.
That's a great question. Um, in Stevenson's, and when that was written, and during the time of DD and BJ, they thought innate law resided in the brain. So you could
Right,
only have interference to the what they called mental impulse going from the brain to the body.
correct.
And you could not have interference to the trophic impulses, which is those impulses coming from the body back to the brain. And as we
So
discover
call me
more,
fair.
what we found,
Wouldn't you just call
well,
me fair?
we found that the innate law is present everywhere, not in the brain. The brain is simply an organ that has its use, like every organ in the body does,
Right.
and that there can be interference not only to the, and we changed the name from mental because mental means exclusively in the brain to innate impulse, which means it's flowing down the nerve tissue going out to the periphery, that somehow a bone can misalign and put pressure on brain, spinal cord, nerve roots, and that interferes not only with the innate impulse, but also with the impulse coming back from the body, the trophic impulse as well. And there's still debate and argument on there. Basically, what it's saying, a vertebral subluxation, when we look at it structurally, can interfere with either side.
Right. Does this only
So,
happen does this only happen to, and it can happen to either side. Um, does it only happen within the spine?
what do you mean? Oh, a vertebral subluxation only happens
Well,
within the spine. Yes.
vertebral, yes, but outside of using the definition vertebral subluxation, can the abnormal signals, mental impulse signals, or the trophic signals happen in the calcaneus?
I mean, it could happen anywhere in the body, I'm sure.
Sure.
But the entity that chiropractors work with, and this is why when we focus on this entity, we say chiropractic is nothing else. Yes, you can have interference to innate impulses and trophic impulses anywhere in the body. The entity that chiropractors work with is the vertebral subluxation exclusively. That anything outside of that is now outside the scope of chiropractic, which is why it's so important for us to have a definition within our office setting the scope of practice, and that definition must be clear and succinct.
It is, and it's wordy for the average subluxated soul that walks into your door.
Now,
Uh,
now when we talk about education for our practice members, we can go about that much differently
sure.
and congruently with how we define it, and it must be congruent.
Yeah.
So at this point, would you agree or disagree with that definition?
Oh, I'd agree with it. Sure. I mean,
Okay.
changing of the terms of it. Sure. There's an electrical
Well,
impulse. There's an
when
electrical
you
impulse
change, if you're
within.
changing the terms, then you're changing the definition. So wouldn't you better say that you don't agree with that right now?
No, the terms have changed because nowhere the trophic and no
Oh,
what you're talking
yeah.
about, it's not written one time in our green books.
It,
And
it is. It is. It's actually in Stevenson. Trophic impulse is in Stevenson's. It's not terribly elaborated upon, but
right,
it
right.
is there.
It's it
Claude
is and
Vassar
it yes.
is elaborating on it now more.
It is because BJ struggled when he would talk about brain cell to tissue cell to brain cell. And this is the only reason, the sole reason why I do upper cervical work is because you can be born without a brain and be alive. So it's not brain cell to tissue cell. And also, the brain was not formed before the heart was. Heart was there before the brain. And so if the heart was there
Okay.
before the brain, but there was, however, we think of the brain that's keeping us alive. The brain's the educated piece. There's an innate piece that makes this thing alive. And then there's a,
Okay.
right? And so there's a
So, all right.
connection.
Yeah,
Oh,
yeah. There's an innate law, and it doesn't reside in the brain. Absolutely. So, would you
so
agree
where,
with
so
that
where's it reside
definition?
then? So where's it reside then?
It resides in the whole body. It resides. You have the
It
innate
has to come
realm.
from somewhere. There has to be a source of
Okay.
which it comes from.
Well, when we look at it in chiropractic terms, now we're going into, okay, so let's just, before we go on, let's just complete that part. Do you agree with that definition?
Yeah, I do.
Okay, cool. So now we can move on to the next. When we look at the 33 principles of chiropractic, and they needed to be more clarified.
Yeah.
So, and Claude Lassard, I'm going to give credit to his work, that amazing work. So we're looking at, and correct me if I'm wrong, we're looking at 19 of the principles are for universal laws,
Hmm.
14 are for a living structure, and 4 are specific to chiropractic. So when we look in the deductive reasoning, you have a universal principle of organization, and that's a principle, and that
Yep.
creates all the principles within the universe. And as we deductively go through those 19 steps, now we are introduced to an innate law that's an extension of the universal principle of organization, and that's going to be within living matter. And we have this innate realm, which is where all the computations happen in the coding and
Right.
impressions and mental impulse. That's in the innate realm. That's going to be in the innate field. The innate field is what is within the matter that it resides in, and that's going to be
Where
within the
though?
whole
It
body.
is. It's in every cell, tissue, and organ of the body, but it has to emanate from somewhere. Because I can't take my hand and if I were to cut my hand, and so not one part of my hand is saying, I'm going to do the healing. The body, somewhere in the intelligence within the spine, is recognizing that damage. And
The,
so
the intelligence is not in the spine. It's within the whole body.
it
It's
is.
within the
Where
whole
is it
body.
emanating from?
Okay, it is. And when we're looking at metaphysics, because I'm not really sure where you're going with this, and I really want to try to stay on track, Eddie.
Yeah.
When we look at metaphysics, there is more space than there is matter within a human body. And within that space lies the innate law.
Yeah.
And the innate law expresses itself within the human body in a few ways. One, of course, as you know, the innate impulse, which used to be called mental impulse.
Right.
Okay. Another thing is called innate rays or waves. That's the direct connection between the innate law in every single cell in the body. And
Mhm.
then we have impressions that are formed in the periphery based on what you're talking about, what's going on. Something's cut. There's the
Right.
innate awareness for everything going on. And those
Yeah.
impressions are then set down as trophic impulses. And then you also have what's called the special senses, that we have 5 or 6 senses that sense our environment, and that
Right.
when we're sensing it informs innate
Adapt.
um, special sense impressions
Mhm.
that are very different from the impressions from the periphery, because they're special senses that are designed not only for the innate law, but also for the educated brain as well to
Yes.
adapt to the external circumstances. So it's emanating from the universal principle that's being expressed within the living matter, and it's found within. Now, if we're looking at the metaphysical, you have the innate realm where all these things are happening, and the innate field is what you're talking about, in which this principle resides within the whole body.
And so would that then be measured educatedly via electrical synapses within the spine?
No, no, it
No?
can never be measured. We never know innate normal. We
No.
never know what innate normal is, so it
Totally,
cannot be measured
totally
ever.
agree. So what we're looking for, I could totally agree with you. So what we're looking for then, when there is an electrical impulse, that electricity is coming from somewhere, we can measure it. It's 268 miles an hour, right? So we can measure the electrical impulses traveling down an arm or leg, let's say. or even out of the spine.
I,
But
I, I, I don't agree with that. No.
you can't measure that.
We're not dealing with electrical impulses or chemical impulses. That may be physical matter. We're
Yeah.
looking at the interface of innate impulses and trophic impulses, which is the intelligence
Yeah.
that's attached to that. The intelligence that we also utilize as force. So that's force information. And what we cannot measure is that information. Yes, we can run an electricity down a dead frog's leg and make the leg thump. There is no information attached to that. So that's
Right.
what we cannot measure under
That
any
I agree.
circumstance.
That I agree. Even though we can add electricity to a tissue and cause like it tends or to cause it to do something. However, when we're not adding and we're watching the effect of it, so the downfall is we get so straight, we get crooked. And the crookedness is there's no application in which we say the power that made us gives the ability to adapt. And when I adjust the spine, innate's on the job. Bullshit. And we have no way of knowing that. Now, chiropractor's been standing on that blindfolded foundation, and this is where Reggie and I would butt heads because we're so philosophically sound that we're missing some sort of effect. Maybe it's blood pressure. Maybe it's, I don't care, urinalysis. I don't care what it is. What gauging system do you have that you know you've done something constructive, educatedly to the body? For us as chiropractors, we're concerned with the spine and what exits out of it called the nerve. And that nerve, when aggravated, disrupts normal electrical impulses. That electricity changes the capillary bed temperature. And every single soul, like a fingerprint or a spinal print, we all have our own unique pattern or analysis within our spine. And when there's
Hold up,
subluxation,
hold up. So we're switching right now. So we're switching right now. What you're talking about, you're going into analysis.
and
Okay.
not even an effect of an abnormal neurologic function. Not even analysis yet, just an effect. What
Okay.
is
So
the
I would
effect?
disagree with that. I would disagree with that.
So would the
Be-
effect be would an effect of a subluxation be restricted of motion?
I have no idea. No, no,
Okay,
nobody
so
does. That's I have no idea what we do not know what innate
then what are
normal is.
chiropractors
Chiropractic, hold up.
palpating? So
But
what are chiropractors palpating?
chiropractic is not concerned with electrical impulses. Absolutely not.
I
Definitely not.
totally agree with you. If we're
Then you said that though, Eddie, but that's what you just said
we
earlier.
have to measure an effect of that. However, that's not the goal to fix the electricity. The goal is to give credit to where credit's due to innate in our educated brain of saying, hey, if I'm palpating a spine and that's crooked and I go pop, I did my job. What proof do you have that you did
I'm
something?
not saying that. I don't know where you're coming from with that. I'm not
What I'm
presenting that
saying
argument at
is
all.
we are not disagreeing in the understanding that innate is in every cell, tissue, and organ of the body. And the goal of innate is to adapt to the environment in which it's placed upon. And then that innate would also give impulses to the educated brain and saying, hey, Eddie, it's cold outside. I can adapt to the best of my ability, but it might be easier to help me to adapt to put a jacket on. That's right. We get so straight, we end up not needing a chiropractor at all.
I
And
don't
so when not
understand.
needing a
I'm not
chiropractor,
following.
innate
I'm
knows,
not
why would I
following
get in
your
the way?
logic. I'm not
And
following your
that's the
logic.
variable of the philosophy. Is that the
No,
philosophy is if it's truly a three-legged stool, your art. But where is the science? And it's lacking. And if it's lacking in all of our teaching, educational schools, it's lacking. So if it is lacking, why is it lacking? Because there's no congruency from one chiropractor to the next of identifying the subluxation and proving whatever their analysis was that a subluxation was adjusted.
okay, all
No,
right, all right. So, but here's where we disagree on that. There is tremendous science in chiropractic, starting with the basic science. And the basic science of chiropractic starts, and everything must be congruent with this, or it's not chiropractic anymore. The 33 basic principles of chiropractic. That is our basic science. So and Claude's done amazing work saying that these 33 principles, they're not a philosophical concept. They are a basic science concept. So if it's not congruent with these 33 principles, Eddie, we're not talking about chiropractic anymore. Hence the reason why it's so important to set a definition with the scope of practice.
So I totally agree. 33 principles can be applied to a PT, to a massage therapist, to an OT. Any profession can use the
Okay.
33 principles. Would you agree?
Not exactly.
They're
No,
not
sir.
exclusive.
No, sir. No,
Only
they
the
are
most
exclusive.
unique is this thing called vertebral subluxation. That's
And
it.
that's part of the 33 principles.
That's the
That's
only
part of
thing
the
that makes it,
33 principles.
that's the only thing
If
that
we,
makes it unique to chiropractic. And if you're going to use the word subluxation, you better prove it to be real.
well, let's talk about vertebral subluxations. And when we say proof now, that's where it gets really interesting. And I would say this. We can demonstrate a vertebral subluxation extremely logically. We have to remember that chiropractic works into the realm of what is possible. And the possibility within chiropractic and the 33 principles, yes, 19 are universal
Right.
to the world. And then 14 are universal to living things, to
Mhm.
trees,
Right. That's
amoebas.
what I mean. All
And
things.
yes, but when we're talking about the 33 principles, and Stevenson was genius to say that this is how we deductively come down that a vertebral subluxation is detrimental to the expression of the innate law.
Yeah.
So, with that being said, chiropractic does have science. And so when we look at that, we understand that we can never know what innate normal is. And there's one thing that all techniques of analysis must have in common. Do you know what that is?
No. I have my own premise.
Every,
Yeah.
okay, everything, but you said no. So I'm going to answer it. Unless you want to answer it. Do you want to give it a shot?
Uh, what I'd like to see it in common, it was established in 1924, is not common today. And so, which is the effect of the nervous system when it's compromising normal impulses via the nervous system of electrical impulses. And so, if there's a side effect, if you will, of a subluxation and it is causing a mimicable, reproducible pattern for somebody.
Okay, you're not answering the question, Eddie. The question is, what do they all have in common? And by the way, science is telling us now that it may not be chemical or electrical, but sonic. So there's all kinds of new research coming out. So we know more than they did in 1927. And we
Oh,
have, yes. And
we
with that
totally
being
do.
said,
But that
yeah,
that
every
technology has
analysis,
changed, but
yeah,
the premise
okay,
hasn't changed. And there's no commonality from the chiropractor, not even the chiropractor that has the
let's stick to the topic. Let's stick to the
yeah.
topic. The question was,
You can't
what
have a
do all
conversation.
analysis?
Go
I'm
ahead.
sorry. The one thing every analysis must have in common, because we do not know what innate normal is under any circumstance for any individual, the one thing every analysis must have in common is that trying to figure out what the innate law of living things is trying to do to restore that vertebral subluxation back to innate normal.
You'll never know. Because why if innate's so great, why doesn't innate move that vertebrae to where it needs to go?
Because matter is limited. And when we talk about innate, we must not
So half-assed.
personify it. It's
That's
a
so
principle.
wrong. It's so wrong. Because of the
Okay,
fact who made the matter? Innate did. So
no,
innate,
no, it
right?
did not. Innate's a principle. No, innate's a principle. It doesn't create or destroy. Innate is a principle. Universal law is a principle. And
So what
the
made the
thing,
matter? What made the matter? What does the healing? You cut your hand. What does the healing?
well, we're not in the profession of healing. That would be
Well,
physical medicine.
I'm not saying that. What does the healing?
When we look at the human body and all forms of adaptation, it is the innate law of living things. It is a principle. Innate doesn't think. Innate is not a personality. That
Oh,
does that
totally
when
agree. Totally agree.
okay.
But if I cut myself, what does the healing?
The innate law within the
Innate
matter,
does the healing.
as long as it can do so within that matter without breaking universal law. Yes, there is a limitation of matter. That
Sure,
innate law must be coherent, must be congruent with universal law.
sure.
And the innate law within the matter in which it resides, when we look at a vertebral subluxation, and if we define a vertebral subluxation as the condition of a vertebra that's lost its proper juxtaposition with the one above, the one below, or both to an extent less than a luxation, which impinges nerves and interferes with the transmission of innate impulse and trophic impulse. So we have 4 points to a vertebral subluxation. And the 4 points would be a misalignment in some way, a collusion of a foramen in some way, nerve interference in some way, and decreased mental impulse. And I would argue that you would have very difficulty in establishing proof for any one of the four. based,
True.
but we must use logic. So when we're looking at it, the best any technique can do is trying to figure out what the innate law is trying to do within the matter it resides to restore that bone back to its innate normal position. This is the logical thing in regards to analysis.
Yeah, so when I do an analysis and I take a 3D image of the spine and I can turn the spine one way and that IVF is wide open, turn this way, and it is dammed up and stenosed, I just proved that there's a narrowing of a foramen. And then making an adjustment, watching that spine change, taking a before and after image, and that before and after image is like, wow, now look how open it is. Is that my goal? Was that my intent? No, my goal and intent is to come in total agreement with you with the four things that make up a subluxation. If we'll agree to those four things making up a subluxation of when BJ was talking about that, and gosh, 1934 in volume 18, he spewed that nonstop. That if we can adhere to that, why can't we adhere to a science that started, I guess some sort of gauging system that started 10 years prior to that, that we can apply today? It's
Well,
so
I'll tell you.
we get
Well,
so
then,
innate driven that we forget that people you have a gauge in the way that you know that you've done something constructive for somebody. And
okay,
so,
so let me ask you this, and that's for the analysis of pre and post. So with that being said, you said earlier that you disagreed that all analysis having the one thing in common of trying to figure out what the innate law is trying to do in that matter to restore a bone to its innate normal position. Do you agree or disagree with that?
oh, I agree with that. The continuity
Okay.
between one chiropractor to the next, I disagree with because
Well,
the
that's not what we're talking about. Let's stick with the
but I
question.
would agree with that. I mean, yeah.
Okay, so you would agree with that part. So having an analysis that is giving you the information of what the innate law is trying to do, and then having that post analysis that a vertebral subluxation has been adjusted, that would be the purpose of analysis, right?
I guess to prove one's intent of saying what you're saying is that there's a compromise of the nervous system and you have a way of gauging that. And then there's
No,
an
no, that's not what I'm saying. I'm saying a vertebral subluxation. I'm specific, very specific here, Eddie.
yeah.
That we have an analysis that identifies a vertebral subluxation and the
Okay.
vector in which the innate law is trying to make the adjustment. And then when the chiropractor educationally places that universal force with the intent of it converting to an innate force, and then having a post analysis that vertebral subluxation has been adjusted back to innate normal, is that the criteria for all analysis?
I wouldn't say all
Why not all?
because there's a structural compromise and a neurologic compromise.
Okay, so
You see what I'm saying? The
no, no, I
incomplete
don't, because
one
here's the thing. We're
chiropractor.
talking about a vertebral subluxation
Mhm.
that has, as we said, the 4 points of a vertebral subluxation must
Yeah.
be there. And if
But
a
would you,
vertebral subluxation, hear me out. That vertebral subluxation must be identified by a sound analysis
Mhm.
that is present and what the innate law is trying to do and the vector it's trying to make the adjustment back to the innate normal position. And then rechecking with the analysis that says this vertebral subluxation has been restored to its innate normal position. Is that the intent of any chiropractic sound analysis?
I would hope so.
So then the answer is yes.
Yeah.
Okay, great. So with that being said, and we can argue different things, if we have an analysis that meets that criteria, is that a valid chiropractic analysis?
If it meets the criteria, sure. The problem is we can prove three of the four. We can't prove the fourth.
I would say we can't prove any of them. You know,
Structural
when we're talking
alignment,
about
area of a foramen, occlusion of a nerve, sure you can. Or compromise of a nerve, sure you can. But again, interference with the mental impulse, you're not proving that. This is why BJ had the EEG, right? And so he would talk
well,
about
actually, it wasn't the EG, it was the electroencephaloneuromentempograph, and
that's the
unfortunately,
whole
he's the only one that's
right.
able to read that, and that still goes off of what you disagree with earlier, that every brain cell is in contact with every peripheral cell, which I disagree with as well.
Yeah.
So I would say any one of those points is a highly arguable because we don't know innate normal. But yet we can logically deduce it. Like, for example, I can argue with you on x-rays on what you said, but I still think you should have the credibility to be able to do that. And there is a large an argument that you can have. There's no doubt about it. You could say this looks occluded compared to the other Freeman, and then I
Right.
could quote Guyton and say 86% by their understanding of the spine is asymmetrical from right to left, and there is 89% or 85% lacking symmetry bilaterally. And that's an argument against you. And once again, that's why we
And it
have
might
these
even
great
be higher. It
conversations.
might even be higher than that, probably.
It might even be, but once again, that's why these conversations are very important.
Right.
So we can have these things because here's the thing. I don't take x-rays because they don't tell me what innate normal is. I use advanced muscle palpation, and we can argue about that later on and have lots of fun with that too.
Sure.
Um,
It's just the subjectivity that creates a variable in your analysis. Because how you palpate is very different than I will. Therefore, there's no congruency from one chiropractor to the next, and the profession will fall. We can yell innate from the mountaintops, brother, but the profession's screwed because there's
well,
no
here's the thing
basic.
that's totally wrong. Number one. Second,
What? The profession is
that's totally
falling.
wrong.
It is. Oh my
It's
gosh.
falling because of advanced muscle palpation.
No, it's falling because there's no congruency from one chiropractor to the next.
I would say this,
That's
that
what.
congruency is in understanding the basic science of chiropractic and having a definition. Even you had a difficult time defining chiropractic. Until we can get a a congruent, clear definition of chiropractic, providing a purpose for humanity, yes, we have questions on why we exist. That is the issue. Is it a technique issue? No, it's not. Should technique be congruent with chiropractic basic science? Yes, it should. The
Right.
fall of chiropractic is the fear of having an identity that's absolutely clear and certain. That would be the fall of chiropractic. Most of chiropractic today practice in healing and getting sick people well, which is physical medicine, making it an alternative to medicine. We are not. BJ wanted separate and distinct. And you can't deny what BJ Stevenson did great things for this profession. We can't deny that, nor should we take that lightly. We
Ever.
need to evolve it. We need to take our understanding and improve it.
Yeah.
And even in their day, nobody really knew what chiropractic was beyond getting sick people well and keeping the well from getting sick, neither one of which are congruent.
Right. No, not even a little bit. It has nothing to do with the 33 principles. Lady walks in the office and says, "How do you know you can help me?" My answer is, I don't. I have no idea what's going on within you. I really don't care about your spine. I'll be
But
honest with you.
don't you think you can help her? Don't you think everybody lives better when vertebral subluxations are adjusted?
However, what I said is I don't know. We don't know what NA's up to. We have no idea what's going on. Until I perform an analysis of your spine to gauge it structurally and neurologically, I'm more concerned about what's going on in your spine than your spine itself. So if I'm more concerned about what's going on in the spine, you better be sure you have a gauge to back that up. And when somebody is just, I can do motion palpation to a cadaver, brother, and I can feel it, boy, it feels restricted here. You can't make an adjustment to it, as you know. So there's got to
Okay.
be some sort of analysis in a way. And a patient walked in yesterday, has been with me 22 years. I performed a scan on her spine, and 22 years later, that matched. That's reproducibility from one visit to the next to know exactly when and when not to adjust. BJ tried to bring that up. That's the only thing chiropractors own. Outside the 33 principles, when there's a scientific gauging system, we own one thing and one thing only, pattern analysis. And I will go to
I,
my
I,
grave.
I would disagree with that, Eddie. I would disagree that one thing and one thing only that we own. Chiropractic is part of a principle for the world. I mean, these are
Oh,
principles.
it
The
is.
vertebral
I'm saying
subluxation is
I'm
an
saying on a
absolute.
gauging application, not outside of the. We don't even own subluxation. We don't
No,
own it.
vertebral subluxation. You do not hear me say subluxation.
Right.
Vertebral subluxation is chiropractic. That is unique to chiropractic.
I disagree. I have a friend of mine who refers people all the time. He's a surgeon. He's like, hey,
Yeah.
man, yeah, I see these vertebral in his notes. I see these vertebral subluxations, but they're partial. Eddie, why don't you go ahead and adjust the spine and do what you have to do, and I'll fix them permanently with surgery. He uses vertebral subluxation. He's an
Yeah,
ortho.
and I get it, Eddie. I get it. I would have picked a better term. There's no profession in the world that's defined the vertebral subluxation like chiropractic. I've never
Totally.
seen it. If he's talking about a medical condition that's a slight dislocation, there is not even close to the definition that we're talking about. And
I
I'm
agree.
making an
I
assumption there
agree, but the
because he's a
term,
medical
I'm
doctor.
totally with you. Like we're totally in agreement.
And yeah, and I get it. Indeed, he could have used a better term, but I love the term now. There could have been a better term, but that's what we're stuck with. And that's our term.
Right.
So with that being said,
Do you
the
realize if you walk
analysis.
in, do you realize, brother, if you walk across the street to my office to the joint and you walked in here and mentioned we talked about any of this, they look at you like you're an idiot.
That's why I'm all over the place, Eddie, and that's why I would debate any chiropractor on the planet. So
Yeah.
here's my thing. My thing is this:
Isn't
chiropractic
it,
gets
wait,
a
hold on.
clear
Isn't it
definition.
tiring though? Isn't it tiring?
I
Should be.
love I love this, Eddie. I love this,
Oh,
and
no, no,
I'm
between
running out
two
of
people
time.
that have like mind, well, we have like minds, bro. We're in the same intention. People like, if you help me or not, you're just better off being adjusted. I said, if you're, this lady came in, she's had cervical cancer. I'm like, just because you have a diagnosed condition doesn't mean that chiropractic isn't going to help you. And my goal is to make your body function at a higher optimal level. By doing so, we maintain this thing called the spine and your nervous system. And when it's working the right way, you're doing the best you can with what you have to work with. That's how I define it. And so by creating an internal environment that could resist external stressors, maybe even an internal stressor with a tumor or the cancer that you're growing, if there's something abnormal, it lets me know that you're vertebrally subluxated. And when you are, your body's making abnormal things, period. And if chiropractors believe that, we would lock arms, man, and going, we own this thing and let's make the world a better freaking place. And we can't because we're chiro treaters. We want to be a replacement for an aspirin and do all the other junk to add to the spine and call it chiropractic. You and I would be, I'll stand right next to you with a freaking guns and Averone, brother, and we'll go to war. I'm with you. You know?
Yeah, I think we can make a difference. If people and Reggie, brilliant in his message, as you said, that look, everybody lives better with the fuller expression of life from the adjustment of vertebral subluxations. So here's what I would like to do. I know this is a great start. Let's continue the conversation
Yeah.
on some more topics. We can go through if you want to, maybe on our next discussion, we can talk about the different theories of instrumentation, and speculations there,
And
which would be
I
fun.
can elaborate, and of course I can elaborate on that. And I, for a selfish reason, would like to hear your theory on the motion palpation.
Well, I'm not motion palpation. I don't do
Well,
motion palpation. I do advanced muscle palpation. Very different. Very,
okay.
very
So,
different. And
to my point, I would like to know more of that.
Absolutely. And just a little background of much respect, I went to Palmer. I'm actually, years ago, I was certified in Kale cervical. I'm very familiar with the thermal scribe and the thermal couples. Dasa Evans in 1923, read volume 18, 8 times. I've read all the green books from
Sure.
14 on. So I do love our history and I'm very proud of it. Eddie, this has been great. We're going to
Yeah.
continue, and I'm looking forward to another talk, and we're going to go more deeper into analysis. So let's give it a couple weeks, and we'll go into analysis. We'll go over
Awesome.
your analysis first, and then we'll go over mine in another topic, okay?
That'd be great. I'd love to disprove you. I'm sorry. Was that out loud? So that sounds
Oh,
great.
honestly, there has been correlations between different types of
I'm teasing, brother.
instrumentation and no, brother, there has been correlation with instrumentation and A&P.
Yeah.
And
Yeah.
as
Yeah.
far as disproving, I welcome all arguments because
Sure.
either I am wrong or I need to argue my case better,
Right.
or I'm pretty good at arguing and I'll take all of the above, but I'm
Yeah.
always up for it. So
We're all
have a great day, bro, and we'll
love
be
you, bro.
talking soon. Love you too.
Thanks, bro. Bye.
Bye bye.